So the organization that I work for is a small community hospital, rural hospital in Illinois, and resources are limited. We had the staffing, but the processes were very clunky. We just knew that we had to speed up the process with accurate information so that the patients would have a better experience. Not only were we looking at wait times and improving our patients, but we were also looking at clean claims. That was like my go-to word from the beginning. If we're going to invest in a product like this and train our staff to use it, they needed to use it efficiently. But where were we going to get the win? And the win was going to be on the back end. The less our billers had to touch, the better. We vetted a couple different companies, but there was absolutely no doubt in my mind that Experian was the way that we wanted to go. The design of the eligibility system is amazing. Prior to the eligibility piece coming on, our average wait time would be about 9 minutes for them to get through the registration process. When we pushed up the eligibility piece, we dropped to 2.5 minutes. We're able to identify the payers that didn't line up with what we thought was in the system. We are able to identify those copays that we never really collecting at the front end because we didn't have that information. I love the fact that it's catching all those things that's going to stop the claim before it goes out the door. We got them on board, and now if you were to ask them, would they want to go back to the old way, it would be an absolute no. It was phenomenal, honestly. We had such a great team right from the beginning. The implementation was awesome, the layout, I mean, everything was so step by step. We didn't have to worry about anything. They knew what the next step was going to be as we designed the system that we wanted, and makes it so seamless for us.